Today we're going to demonstrate a patient portal that is brought to you by Spring Medical in collaboration with NoMoreClipboard.com. And this portal is going to enable your practice to comply with meaningful use requirements around patient engagement to help you qualify for your ARRA stimulus money. And today we're going to demonstrate a branded patient portal that is actually branded to the look and feel of in this case, a cardiology practice. So we've created a fake practice called Oak Creek Cardiology, and rather than have their patients show up early for an appointment to fill out a clipboard full of registration forms, they encourage their patients to go online and click on the online patient registration button. When they do so, they are taken to a login page, and if they have an existing account, they can log in here, or if it's a new patient, they can click this button. They will be prompted to review and accept the terms and conditions, and then they can enter their own unique username and password. Now today we're going to take a look at an existing account, so we're going to enter the appropriate credentials and log in. This takes us to the Oak Creek Cardiology Patient Portal landing page, and from here the patient can conduct their business and communicate electronically with Oak Creek Cardiology. As you can see, we've also retained the look and feel of the Oak Creek Cardiology website so that their brand is preserved. Now today we're going to start off by pre-registering for an upcoming appointment. So the patient will click here, and they're actually taken to a list of members that are associated with this existing account. And each individual account can contain up to 10 family members. Now today we're going to take a look at a demo patient, Sean Donnell. So we click on Sean, and we're taken to a wizard-driven member review process. We've tried to make it very, very simple and very user-friendly for a patient to be able to populate their personal health record. Things like demographics that we're looking at here are very simple to populate. And then when you get to the medical content, for example, if I wanted to enter a new medication, we go to the medications list, and I simply start to type in a letter or two, and I'm presented with a drop-down menu of options. Now beneath here is the First Data Bank drug library. So unbeknownst to the patient, as they enter medication data, they're actually entering coded, discrete data that can be shared electronically with the SpringCharts EMR. So it presents the most common form and strength, and then the patient can enter the appropriate instructions, the date that they started taking the medication, and we'll start that today. They can add that to their medication list, submit that, and proceed. Then things like patient allergies are just as simple. If they start to type in the name of an allergen, they will be presented with a drop-down menu of options, and that intelligent autocomplete functionality is built into the entire personal health record. So the patient will go all the way through this process, and at the conclusion of the review process, they'll send their information, and then they'll be shown a list of available clinicians associated with this practice. In this case, we have a test provider for Oak Creek Cardiology. And if I click on that provider, I am then presented with some additional questions that are unique to the Oak Creek Cardiology practice. So we automate any questions that we don't normally collect, so the patient can go through and respond to these. So for example, the reason for my upcoming visit might be that I have swelling in my legs, and I was referred by Dr. Smith. And I could go through and answer these additional questions. I then submit that to the practice, and I'm going to receive back a success message letting me know that my data has been transferred. I can even then print that out and take that with me to my appointment at Oak Creek or to other physicians as well. And from here I can return back to the home page. In addition to sharing pre-registration information, the portal also enables secure messaging between the patient and the practice. So you can do things like ask a nurse a question, ask a billing question, request a medication refill, or request an appointment. And these are all optional modules which you can turn on or off whenever you're comfortable with it. Let's show you an example of requesting an appointment. So I will click on this. Again, it shows the list of patients that are a part of my account. Again, we'll go to Sean Donnell. And then I'll select the appropriate physician, and we'll again load in the list of physicians. Today we're just using our test provider. And then I can select the appropriate days of the week that I prefer. And these can all be customized based on the hours and days that the practice is open. What time of day. I can indicate the degree of urgency. In this case, I'm going to say the next available. The reason for my visit, again, swelling of the legs. And contacting me for follow-up is fine via the personal health record inbox associated with this account. I can add any additional comments. And then I submit this to the practice. And again, I get a success message letting me know that the information has been sent. So I'm satisfied with all of that. I return back to the home page. Now we're going to log out of the patient view of the portal, and we're going to log back in as an administrator from the practice to see what happens within the four walls of the practice after the patient sends these messages. So we'll log out, and we're going to log back in. And we go from the same landing page, and what we come into is what's called the NMCMD portal. So this is the administrative view from within the practice, and from here you can manage things that have been sent by the patient. You can store, print, manage items. And you can look at everything that's been sent by patients. You can also sort these things by type. So for example, I can click on just the appointment requests and see the requests that have come in from different patients. I can see items that have been sent just to me. And the login privileges that are associated with this account can be tied to specific items. So for example, you might only want one person in the practice to be able to view appointment requests, while another individual might be responsible for just managing prescription refill requests. So these tasks can be assigned to individuals who have their own unique logins. Now in this case, we'll take a look at all of the open items. And what we want to take a look at is the Oak Creek Cardiology patient registration form that was sent by our patient Sean Donnell. So we'll click on that, and it actually brings up the patient registration form. Now the nice thing about this is it's transmitted to the administrative portal electronically, and it's rendered onto the Oak Creek Cardiology registration form. So rather than using a No More Clipboard form, which the practice would have to get used to, and they would have to hunt for the information that they're used to seeing in a new and different place, we are actually able to take the data and render it from No More Clipboard right onto the specific registration forms used by each practice. So there's no appreciable change to existing workflow, and the practice gets their same forms that they're already used to, but they're more legible, accurate, and complete than those same forms filled out in the waiting room. So you can see we've taken all the data, sprinkled it directly onto the form, and we transmit that to the practice. So they get a complete view of the patient health history. In addition to reviewing the incoming patient registration forms, I can also take a look at things like appointment requests that have come in. So I'll click on the online appointment requests, and we'll take a look at the request that Sean Donnell recently sent. So here it is coming into the administrative portal, and it lets the practice know that Sean would like to be able to see this particular physician on Wednesday or Thursday afternoon on the next available appointment. So from here we can reply back to Sean, and we can enter the type of response, and then we can put in a customized message. Sean, we will see you at 2 p.m. on Thursday. See you then. and we can submit that to Sean. And then we will receive back, again, a success message letting us know that, that Sean's message has been sent. So we get back this success message that the document has been created for Sean Donnell. And Sean will actually get an email letting him know that he has a message waiting for him in his No More Clipboard inbox, and he'll be able to log in and take a look at that message. In fact, let's log out of here, and we'll log back in as Sean Donnell. And Sean will actually proceed to view his unread messages. And here he sees an appointment request response. He clicks on that, and here's his response. Sean, we'll see you at 2 p.m. on Thursday. See you then. So Sean can then say, wonderful, enter that into his Outlook calendar, and then delete the message. And with that deleted, he can return back to his home page. In addition to this portal functionality that enables that direct messaging between the patient and the practice, the patient can also view the contents as a personal health record. And in this case, Oak Creek Cardiology is sponsoring that personal health record on behalf of the patient. So again, we'll take a look at Sean Donnell. And as you can see, this is kind of a one-page dashboard view of all of Sean's health information. Down the left-hand side of the page, we have demographics, insurance, Sean's preferred healthcare providers. There's a document section where Sean can upload things like copies of old medical records, power of attorney, living will, images, virtually anything that he would like to store. On the right-hand side, you can see that we have all of Sean's health information, so meds, illnesses, procedures, etc., all the things that we collected as part of the member review process. We also have a data tracking section, so Sean can go in and keep track of things like his blood glucose. Sean was recently diagnosed with diabetes, so he's able to go in every day and enter in logbook format his diabetes glucose readings. He can graph those results over time, and he can even create a summary report of his blood glucose readings that he can share periodically with his physician. So in summary, what we've done is we've created this branded portal. It's branded to the physician practice. It enables the practice to share information electronically with the patient. The patients can pre-register. They can do things like request appointments and request medication refills. So it not only satisfies our requirements around electronic engagement of patients, but it also streamlines administrative efficiency within the practice, reducing phone calls and making it easier to correspond electronically with patients. In addition, the patient now has an Oak Creek Cardiology sponsored personal health record from which they can manage all of their health information for themselves and their immediate and extended families.